Hello everyone, welcome back to my channel Empowering Aesthetic Excellence. I am Dr. Bhavna Agarwal, aesthetic physician, facial aesthetic consultant, and a beauty psychologist. This is the series which I'm doing, question of the day. And currently I'm taking all the questions pertaining to cheek fillers. So today's question is related to cheek fillers and dental work. Can I get my dental work done after getting cheek fillers? Well, this is something very interesting and needs to be addressed because most of us who get fillers, at some point in our life, we need to get some or the other dental work. So there are few things which we need to know. So when we discuss about cheek fillers and dental work, there are basically three things that we have to understand. The first one is that it is important to avoid manipulating the cheeks and gums too soon after a filler injection. Now, why this is important? Because it can potentially affect the cosmetic outcomes. Because when you get a filler done and after the filler treatment, you are getting some dental work done, which will involve some kind of pressure or movement in the cheeks area. Uh, Immediately after the filler treatment, it will disrupt the placement, distribution of the filler. It might cause, a filler migration, and this might lead to uneven results or some premature dissipation of the filler. So this is one thing that has to be kept into consideration. The second thing is that there is always a chance of, introducing some kind of infection if a dental treatment is done post filler treatment. Because we have the same area, where the cheeks and the dentition and all. So the area is almost the same domain. So, and certain dental procedures will involve administration of anesthesia through small needles. And this can carry a risk of introducing certain bacteria or infections into the area where the filler is introduced. And there is a delicate balance of oral microbiome and which can be disrupted during the dental work. So, if proper precautions are not taken, then this infection can compromise the healing process and potentially affect the longevity of the filler treatment. So this is another thing because our mouth, our oral cavity is home to a lot many number of bacteria. So this is something very important, and you should always discuss your filler treatments in case you have an upcoming dental treatment for yourself. Now, the third thing is the biofilm formation. Now, fillers are basically implants within the soft tissues of the face. And so, like any other implant, they are also susceptible to biofilm formations. Now, dental procedures can introduce bacteria into the bloodstream, and they can increase the risk of biofilm formation around the filler implantation sites. And then they can again pose the risk of infection and inflammation, impacting the success of the filler treatment. So now that brings us to the point where we need to space out our treatments. And so now we know that dental work can displace cheek fillers. Dental work can cause infections in areas where fillers have been placed, and so they should be spaced well. Now, if emergencies are there, then they should not be delayed. If dental treatment, cheek filler is never an emergency, but if dental treatment is an emergency, then you have to inform to your practitioner about your recent procedures. And to summarize, so if you're considering a dental work in conjunction with cheek filler treatments, it is important to evaluate the timing of the procedures to minimize the risk of infection by proper sterilization, hygiene practices, and be aware that, patient safety and outcomes are very important in both the conditions. So to summarize, or this brings us to the point that what is the interval between the two treatments. So basically, when you do some research and read some papers, they say that it's like an interval of 2 weeks is important. So if you have a dental treatment after a cheek filler, then wait for 2 weeks. And if you have a dental treatment done and you want to get a cheek filler done, again wait for 2 weeks. But I would suggest, to be on the safe side, and to avoid any kind of risks, uh, always, space it out at an interval of 1 month. It is always better. So this is what I had to, discuss about the cheek fillers and the dental work. I hope this helps. And if you have still any queries relating to this, do share in the comments below. I'll be happy to answer. Thank you for watching, and see you in the next video.